And for those on the East Coast, good early afternoon. My name is Wendy Whitmore, and I'm here to present the free learning lunch today on how to grow your managed service provider and technology business in the healthcare industry. As I mentioned, my name is Wendy. I am the Chief Learning Officer at ForMed Plus. I have quite a bit of experience in this area. Not only have I been managing ForMed for the last 10 years, prior to that, I actually did have a technology company that was focused in the healthcare vertical. I worked with a lot of clinic-based, practice level, and hospital level clients as it relates to technology, consulting, and services. And so this particular area is of great importance to me as it relates to the industry being serviced correctly. And I hope that the topics that we'll cover today might be helpful to you in terms of understanding a little bit more about either expanding your business if you're already working in the healthcare vertical, or perhaps moving into the healthcare area a little bit more aggressively if you are running a managed service business or a technology business. Just a little bit of background on ForMed. We are basically content developers and training providers in areas of health information technology and electronic health records. We also cover areas of healthcare compliance, regulatory issues, government incentive programs. We focus heavily on HIPAA and cybersecurity compliance in the healthcare areas and in business management and leadership as well. As a note, after this session today, about an hour after we're done with this particular session, we will send you an email with a copy of the session slides and a link to the recording of this session as well, in case you'd like to review it a little bit later or share it with somebody else in your organization. We will provide you with that. We also have offered you a certificate level proficiency course from our course catalog that talks about healthcare marketing and sales outreach. We will provide you with information, a secondary email after that with information to join our learning management system, to attend that certificate course for an actual credential. So all of that will happen about an hour after our session today. If you have any questions throughout the course of this brief presentation, feel free to enter it into the chat box. If we have time at the end of the session, we will try to answer it. I will try to answer your questions in real time. If we run out of time, we will shoot you an email after the fact, or everyone an email, I should say, with a summary of the questions and answers related to this particular session. So feel free to pop questions into the chat box if you have them. If you're having any technical difficulties hearing us or seeing the presentation, you may also pop those into the chat box and somebody will help you with that. But again, we are representing ForMed Plus in this presentation, and we are basically connecting with you to talk about the growing of your healthcare business in this particular healthcare vertical. So, as a learning officer, I'm very focused on learning objectives, and the learning objective of our event today, or our learning objectives from top to bottom, are to start with understanding a little bit more about why managed services and technology services are so important in healthcare. If you're already working in this vertical, you may be familiar with these various reasons, but it is critically important that technology services be available to healthcare providers, clinical providers, and medical sites for a whole host of reasons. We will talk about that. We're going to talk a little bit about the business associate or BA position and role and how it relates to healthcare clients, because that is very important from a technology provider standpoint. We're also going to describe common healthcare site tech issues and service needs. For those of you already working, you may see a few extras in there that you hadn't thought about. So we hope that we're going to spark your imagination as it relates to working with medical and healthcare clients. We're going to discuss primarily the challenges in outreaching to healthcare targets. This is a big part of why we're running this session today. Essentially what we find and what I found when I was working in technology in the industry is that healthcare is a very, very different end user market. It is not a standard business target for your managed services and technical services. These folks respond very differently to marketing for a handful of reasons that we will discuss. And then we're also going to talk about taking what we call the trusted advisor model into those sales and marketing discussions with your staff and as it relates to the potential target for your services. We're going to highlight some successful outreach methods that I have used in the past with my businesses that I continue to use to talk about marketing and communication. We're going to talk about education. I am an educator after all, so I am going to focus a bit on education and talk about why that is so important and perhaps more important in healthcare than in any other vertical that you'll work with. We're going to talk about my 8-point plan for healthcare industry growth toward the end. I'm also going to show you a few free resources where you can get additional health IT information. And we're going to talk a little bit about skills and tools that you can add to your service model to increase your value to those healthcare clients. Okay, so those are our learning objectives today. So let's dive right in. First of all, for those of you already working in healthcare, you're going to be familiar with some of this list, but perhaps some of it might be highlighted to you as areas that you could address that you might not be currently addressing. But essentially, healthcare staff and healthcare environments, the people that work in those environments are not particularly focused on computer technical skills. Doesn't mean they don't have them. Doesn't mean they don't have somebody in-house to help them. But it does mean that this is not their cup of tea by and large. People in healthcare have studied a long time and have worked in their career to be able to provide patient care primarily. And that is their focus. So computers, even though they are a huge part of healthcare these days, computers are not their favorite topic. And you'll find that as you start to work with people in this area. This is not an area that they necessarily feel warm and fuzzy about. Technology is really dynamic. It has a lot of technical focus as it relates to modern medical care. We'll talk a little bit more about that as we talk about the services side. And healthcare sites are especially vulnerable to hackers and security issues. 32 million patient records were breached in the first half of 2019, and that is more than twice as many as in 2018. So that is the vulnerability to security issues for healthcare sites is massive. And that's a piece of how you can communicate with those potential healthcare clients, is to be fully versed in some of the statistics related to security issues around healthcare, the healthcare vertical. If 32 million patient records were breached in the first half of 2019, I wonder if you guys can guess what percentage of that was caused by hacking. It was a much higher number than I would even imagine. It was 88% of all of those security issues around patient record breaches were caused by hacking. So those are the kinds of protective services that are so critical to these healthcare sites and clients. Regulatory requirements around HIPAA, which is the Health Information Protection Act, those healthcare records are highly targeted by hackers. And understanding the regulatory requirements around protecting that patient health information is very, very important. PCI DSS, which is the payment card industry regulatory area, that can be very legally risky for medical practices as well. All of the services they provide are going to be paid for in some kind of, the co-payments, all of those are taken via credit card and payment card on site. That patient data is oftentimes through the electronic health record and the practice management software linked with this payment card information. Protecting those healthcare environments that way, also very important. All patient data nowadays, because of the HITECH Act that was rolled out during the Obama administration, and because of really, quite frankly, just modern patient care delivery, all patient data is now maintained using some kind of computer network server or software as a service system. Medical technology is rampant, running through the whole industry, very, very critical to continued accurate tracking of patient care. Encryption, staff security awareness, those are critical to breach prevention. We'll talk a little bit more about that. Monitoring and maintenance, what you do with your managed services business, hypercritical to ensure patient data compliance from that practice, from that clinical medical site, all very important. Technical knowledge is required to configure security correctly. You guys have that technical knowledge. That is something that these healthcare sites absolutely need. They need it not just at the level of standard business, but at that patient health information protection level. They need security even more than most other verticals that you work with. Remote access to data for medical professionals like physicians, physician assistants, hypercritical for optimal patient care. And that also requires data protection and data disaster recovery, including policies and procedures. These are all services that technology companies are able to provide for healthcare sites and clients. Let's talk a little bit about the definition of and the understanding of the business associate role. HHS, the Department of Health and Human Services, requires now that technical service providers, managed services and IT providers that work with healthcare environments are considered business associates. And by that I mean somebody outside of that covered entity means the medical practice or the medical site itself. If you are performing functions on behalf of or certain services to that medical practice, that medical site, then you are considered, as it relates to the Health and Human Services Department, a business associate, because you are part of the team that helps to protect that patient health information, that protected health information. So any managed service provider, IT service provider that maintains or manages or supports systems that contain any kind of patient health information on any level is potentially subject to HIPAA regulations. And if you don't fully understand HIPAA regulations, healthcare is not the business you want to be in, because you are going to put your business at risk, and you don't want to do that. It's not that complicated. You really just need to train yourself in the same way that you've trained yourself to do hundreds of other technology-related tasks, to understand HIPAA regulations and requirements. And you also need to sign something that is called an active business associate agreement with any healthcare client. And we'll talk about that in a moment as well. Fines for non-compliance with HIPAA for managed service providers and IT folks can be really devastating. So this is a piece that if you are going to work in healthcare and you want to expand your business into this vertical, you really need to absolutely understand how HIPAA works, how the business associate agreement system works. And if you don't currently have BA agreements in place with your healthcare provider clients, you need to make sure that you take care of that right away. You always want to establish business associate agreements with those clients. One major service that you may provide on behalf of your healthcare clients in terms of growing your business into this area is that healthcare compliance officer level service. Now, that's not something that everybody is going to want to do that works in managed services or IT, but it is a way to effectively grow your business into that vertical. But apart from even providing that as a service to the client, having a HIPAA compliance officer level of understanding of the industry can lend you a high level of credibility with those potential healthcare clients. So if you have not yet certified at this level or maintained a certification at this level, that is a piece that you probably should take care of. And you should also probably make sure that everybody in your MSP and IT service business has a HIPAA awareness. Okay, they may not all need compliance officer level understanding, but if they are working, if they are touching the systems interior to a healthcare environment, and those systems are in any way tied to that protected health information, you're going to want that area of your staff to be skilled and knowledgeable at this level. Okay, so we do recommend that you focus fairly heavily on a comprehension of this regulation, because it is the protection around the information and data that is housed primarily in healthcare environments, and that is also vulnerable from a security standpoint in healthcare environments. Okay, and it is also a service that you can provide, becoming an outsourced compliance officer. It adds value to your managed service and IT business, and it helps you to achieve a higher level of credibility with those potential clients. So let's just cover some of the common healthcare site technical issues and service needs, things that you should be able to provide if you're going to go into the healthcare vertical. And as I'm talking about this, let me mention that from a marketing standpoint, we'll circle back to this in a moment, but from a marketing standpoint, you're going to want to let potential clients know that you can provide these kinds of services that are unique to them, unique to their vertical. The more that they understand that you care specifically about the importance of their healthcare industry, the higher that you will rank on their list of potential vendors. So common services that happen in healthcare sites: network server installations with high-level security standards and special data partitions. So network server installations, not all medical sites will require a server install. However, even if they are using a SaaS solution for electronic health records or a cloud-based solution, they may maintain a server on site to share information between their workstations at the site itself. They may also use it as a backup for those patient records. So understanding network server install, which all of you do, I am sure, and understanding the high-level security standards that are required by HIPAA and that are required by PCI DSS for healthcare data, and creating special data partitions will be a piece that you want to be familiar with. Understanding high protective router configuration, special protections around that protected health information and other patient data will be very important. Encryption is critical. For those of you who are already compliance officers, you know this. For those of you who are not, secure encryption on the workstations, laptops, servers, portable drives, any communication going back and forth, this will protect any breach, post-breach investigation and fines that could happen. So how HIPAA works, and HIPAA outlines specifically that if, for instance, a portable drive or a laptop is lost and that data is compromised, if that laptop or portable drive is documented to be encrypted and is properly encrypted, then the fines and the liability is reduced exponentially. And so understanding secure encryption is hypercritical for the healthcare vertical. Hardware configuration for electronic health records and software around, software as a service, software loaded onto servers, Many of them are cloud-based nowadays, but in larger facilities, maybe server-based. Understanding that configuration is also very important. Payment system setup, weirdly, the security around that is very, very different in healthcare environments. Patient check-in kiosk setup, Wi-Fi, securing guest Wi-Fi so that folks in the waiting room of healthcare environments, clinics, etc., are not in any way able to access secure information in the practice, but are operating on a separate channel in the Wi-Fi. Vulnerability checks around security, pen testing. You guys all know how to do all that stuff, which is awesome, but utilizing your skill set and understanding HIPAA and healthcare will be very important as it relates to that kind of work. Officer level support, as we talked about. Annually required risk assessments. These are ways to incorporate your pen testing and other levels of security assessing to help them complete something that they have to do every single year. Great value add service. Talk about that a little bit in a minute. Remote data access, mobile health product, and telehealth service setup. This is something that is especially unique to healthcare. Being able to access those electronic health records remotely and securely from, for instance, a physician or PA's home in the case of an emergency, where let's say a patient is in an emergency situation and they want to be able to access that patient data from their home or while they're traveling, etc. The security around that is hypercritical to healthcare providers. Mobile health products, so patients who are wearing various tracking devices that are going to give medical information to the medical practice remotely and pass them through a secure link to the patient portal, etc. Those kinds of setups are also very important. And telehealth, this is new. Telehealth is growing hand over fist, basically, year over year. And more telehealth services are popping up and actually attaching themselves to traditional healthcare environments. So that if a physician needs to do a consult with a patient and the patient cannot come in for medical reasons or for distance, rural health reasons, telehealth is becoming more and more popular. And understanding how to set that up, also very important. Way at the top of my list is understanding virus, malware, ransomware prevention, implementation and monitoring. When I said that 32 million patient records were breached, more than twice as many as the year prior, and 88% of that was caused by hacking. You want to understand how to prevent that from happening. Ransomware especially has been an acute problem in the healthcare vertical of late. You see it in the news. If you haven't, Google it, you'll find it. There is a lot of ransomware being accidentally installed, more often than not through a lack of education on the part of the practitioner, front desk folks, the client side itself, and protecting those practices and those sites from that kind of attack is hyper critical. And your managed services, from my perspective, and from being in this industry myself formerly, I feel is also something that is uniquely hyper critical and important in healthcare environments. So ongoing secure systems monitoring and maintenance, exactly what you folks do, very, very important in healthcare. Okay, now let's flip to what we're really here to talk about today, which is understanding how to outreach to these healthcare markets and grow your business in those markets. To begin, we're going to talk a little bit about the challenges in this vertical. They are many. I pulled out the 4 most common challenges to talk about with you today. Way at the top are that healthcare sites and medical providers are constantly feeling the sales pitch, right? Because pharmaceutical reps are always banging on their door, medical product and device suppliers are always banging on their doors, various service providers for their environments, providing anything from pharmaceutical cabinets that you can lock your drugs up in, etc. These people are literally fielding sales calls daily. People show up on their doorsteps every day. You do not want to be one of those people, because essentially with that sales burnout that happens, they're immediately going to dismiss you before you've even had a chance to get your message out, because they are so overwhelmed by this type of outreach. In addition, practice owners and managers in medical sites, as we talked about before, are actually trying to do real jobs. They don't like computer stuff. They don't want to talk about that stuff. They're not particularly personally interested in it. And they have a really important patient care job to do. They're trying to focus on that. So you've got to figure out a way to draw it to their attention, the importance, and get your message into them around all of that happening. Technology is also misunderstood in this industry, especially as an area where practitioners feel like they can save money. This is a common problem. It was certainly a problem when I was in practice. It continues to be a problem. The more I talk to tech professionals that I work with through our education programs, and in healthcare, especially small practices, they will try to save money by, hiring their neighbor who really understands tech stuff. I can see some of you smiling right now, because I'm sure you bumped into this, because that guy's super techie and he knows a lot about computers, that kind of reference back at you. So if you're talking to a practice, or you're talking to a potential target, and the message back to you is, hey, I don't really need a managed service provider. I don't really need a technology professional, because my next door neighbor is really good with computers, or my nephew, or my cousin, or whatever it is. And this is an area that you're going to want to address, and we can talk about that as well. And then traditional methods of outreach tend to fall flat. This is kind of the same as the first bullet, but a little bit more about language. Sales language in messages to these folks and in first-person conversations to these people is often just filtered to junk, because they are so, like I said, inundated by those other sales folks. So how do you approach this market with a different kind of model? My recommendation, based on my experience and my relationship with these medical sites, you can imagine that as an educator in this space, I have a lot of conversations with clinical professionals on a regular basis around the topic of technology. And I do a lot of presentations at conferences and things on this subject. Essentially, what works well with healthcare providers and healthcare sites is to become what I call a trusted advisor, as opposed to just a managed service provider or just a technology provider to them. There are thousands and thousands of people who do what you do in other verticals, but when they work in healthcare, if they can build a trusted advisor model for that side of their business, they will have a way higher percentage of success with this potential client. So just as medical providers spend a lot of their time focused on advising their patients, they are going to respect that model in you. So if you're mirroring that trusted advisor model to them, they are going to have a higher level of respect for you. And if they trust you and they believe that you have their unique needs in their best interest in mind, they're going to be more likely to engage in and develop a long-term relationship with you. And trust is something that you earn through a really solid grasp of health tech issues, of course, your ability to communicate those clearly. So all those areas that we talked about of specialty in healthcare, you're going to want to understand how those technical service areas relate specifically to healthcare. And understanding that and being able to communicate that into that potential target site is going to give you a huge leg up as it relates to these particular clients. And one of the ways you can do that, demonstrate that knowledge, is what we talked about before, which is through training and understanding of healthcare information. We're going to give you some free resources for that and talk about some training for that. And coming into that potential environment with your business associate agreement in hand, sharing with that potential client that you fully understand that that business associate agreement is important and that you understand how it relates to their specific healthcare focus. So let's talk about some steps in sales outreach methodology and marketing in healthcare. There are ways to approach this market that might be unique or slightly different from how you would approach business targets or other targets for your business. One way is to connect through the folks that are basically the gatekeepers in these environments. And in many cases, those are going to be the practice managers. Okay? Practice management is a role or position that is, like any manager in any business, but practice managers in particular are going to come from a couple of different perspectives. There either will be an in-house practice manager, or they may be an independent practice manager that oversees a number of different practices under their advisory. And coming in at that level is also going to allow you to create a level of trust. If you are able to meet with a practice manager, convince that practice manager that you have a solid understanding of healthcare specific technology and IT support, that practice manager then is going to give you that handshake into the decision maker's office. And in many cases, the practice manager may in fact be the hiring agent or the decision maker. So you're going to want to research and investigate avenues to approach the practice manager directly. One way you might seek that out, there are lots of associations specific to the practice management community. The MGMA, the Medical Group Management Association, for instance, has a large contingent of practice managers. If you go to LinkedIn and search for practice manager groups on LinkedIn and organizations, you could potentially target them that way. Another way to come in is through existing trusted product and service vendors. If you are at a conference or a networking event and you connect with another product or service vendor that works with a lot of medical practices or medical sites, that might be another avenue for you to reach into that vertical. Any kind of credible referral like that is going to help you in this market. So that's what we're talking about with that second bullet as well. Engaging through direct or indirect referrals is a highly effective way to outreach into this particular vertical. Doctors trust doctors. If I were going to invent a marketing program that was specific to this vertical, I would utilize that as my nomenclature. Doctors trust doctors. That's the truth. And the more doctors you work with and can build up a referral base, the more that other doctors will trust you. And that is just a fact of this business. So one way to get that, that first bank of doctors, or if you're already working in the healthcare vertical, start to ask for referrals from those doctors, or at least recommendations. Ask them if they are willing to make recommendations, because if they are, whether it's written or in a brief statement that they might make for your website, or if their practice manager is willing to speak on their behalf as it relates to your particular service, that is a great way to get other physicians, practices, sites to respect you, is by indicating that you've already worked in this vertical. The other way to approach this vertical is to attend networking events that discuss health IT and security. These happen all the time, every day, everywhere. Unless you are in a very rural area, if you're in any kind of urban area, you will find networking events. Again, LinkedIn is a great resource for searching for those events, and also diving deep into some of the free resources that I'm going to share with you and finding these events. Attend those events, register, go to them, look for ways to connect with the people who are delivering these kinds of services. This will help you not only get familiar with the industry and the target market, but also learn to talk the talk. This is a great way to connect, also to get a feel from other people who are working in the industry about how to, particularly in your service area, look for those potential targets. Once you are fully invested in this area and you feel knowledgeable, for instance, about this, even a very specific security topic in this vertical, you might actually go to the trouble of creating a small networking event and inviting potential targets in your service area to it to learn more about security services. This is a great way to bring potential client targets into your knowledge base and let them see how smart you are. So by creating simple networking events, they don't have to be very long. Doctors love to get free things, and medical practice managers love to attend free events. If you create a free event and invite these folks to come in to your event, you are then able, whether it's a webinar, online virtual event, or an in-person event in your service area, this is a great way to show what you know. And showing what you know is one of the best ways to prove that you are a better choice than other IT or managed service providers for this kind of service. And that's that next bullet as well. Leveraging your security education, leveraging your awareness and your knowledge as you build that into those clinical sites. Talking about hot topics is a great way to do this. This is a great way to bring people in, show what you know, and prove that you are the best choice for them around this kind of service. So another way you can approach this market, and I have seen this work very well, I've certainly done this myself, is to give something away for free as it relates to your managed service provider contract. So for instance, we talked a little bit about free risk assessments. If you're not familiar with how the risk assessment system works, then you will have some of that information through some contact information that we're going to provide later. But you could potentially, for instance, provide a free risk assessment with any 6-month MSP contract or annual MSP contract. You could potentially provide awareness training around HIPAA and cybersecurity with an annual contract. Promote using something that they need, but that they don't want to pay for. Okay, risk assessments and awareness training are all things that they have to have every single year. But it may also be something that if you can figure out how to give that almost like a freebie, you might be able to bring them into a full-length contract by offering something that they need, but that they don't like to pay for. And then lastly, and this is very, very important from my perspective, build out a reference page on your website. And I say this because I have looked at MSP websites for the last 10 years as it relates to my business. And in many cases, those service providers and health IT organizations, even when they're working with healthcare clients, do not have a special reference page on their website that talks about their healthcare services. Don't make that mistake. If you're going to target this market, build out a page on your website that talks about your healthcare services. Even if the service list is very similar to the rest of the services listed on your website, talk about why you know more about those services as it relates to healthcare, because they are different. The way that you approach the market is different. The security level that you need to understand for this market is different. Talk about that. Create a reference page on your website that talks about your services as it relates to healthcare. Very, very important part of your marketing strategy. And as a learning professional and as a learning officer, I'm going to talk to you about that web page that you're going to put on your website to reach out to this market and grow this market. And I'm going to talk to you about why your knowledge and what you know is important to outreach to this market and the growth of this market. Education is hypercritical for yourself, for your staff. If you're a small group, make sure that everybody in your group has this specific awareness, or rather, everybody that you're going to assign to these healthcare clients has this specific learning associated with their technology skills. Medical professionals studied a long time to get the degrees and certifications and licenses that they need to provide healthcare service. You, as a technology professional, also studied a long time and got licenses and certifications to do what you do. Make sure that your target in this market understands that. Highlight the education that you have, the skills that you have, the certifications that you have. They will respect that because they had to do it too. And they can't do their work without these licenses and certs. And they want to know why you are smarter than anybody else banging on their door looking to offer this service. Healthcare specific training as it relates to security and technology will also help you set yourself apart from other professionals in this vertical looking to grow their businesses. So ongoing professional development around healthcare in this vertical shows that you're invested in staying up to date with technology specifically in this field. And that is going to give you a spot at the top of the pile when they're starting to choose or looking to choose someone to help them with their technology. We talked a little bit before about professional referral. I cannot stress enough how important this piece will be to your growth. This is probably true in many parts of your business, but as you grow a healthcare client base, continue to ask clients if they're willing to provide referrals for your service. As I mentioned, healthcare is unique. Medical communities trust recommendations from within their own community. They regard that at a much higher level than any other kind of referral that you can do. If you don't have healthcare clients yet, get one and do what you have to do to get that first healthcare client and kill it. Do a great job. Knock their socks off. Get the right training, understand HIPAA, sign the BA agreement, do all of those steps right, and then make sure that you leverage that first client or that first bank of clients to grow the business and bring in more clients. One way that you can do this is to create a simple form that you can leave with those clients, asking them to authorize the release of a recommendation statement. So that can be provided by the front desk folks that you've worked with an in-house IT person that you've worked with the practice manager, if that's who you're working with, anybody that hired you into the project, if there's an outside project hiring agent, those people, you want to get that potential recommendation from them, and you're going to want to leverage that in order to help grow your business. You're going to put that on your website. You're going to put that out there as something for someone to reference who's potentially considering you as an offering into their service business from a healthcare perspective. Okay, so those are some strategies that you can use to grow your business. I'm going to give you a step-by-step 8-point plan here to talk about how you should grow your business. Some of these steps you may have already accomplished. You can draw lines through them. Good for you. Congratulations. Others you may not have done yet. In any case, you're going to want to take this 8-step process and make sure that you've accomplished it in order to execute this growth plan. So first of all, make sure that you know what you're talking about. Train yourself and your staff. Make sure that they understand healthcare specific requirements and regulations, especially around HIPAA and security. Those are the two areas that you're going to want to care about most when it comes to technical services and support. There are other areas too. The more you can talk the talk, the more familiar you can be with the acronyms that they're going to throw at you from a technology standpoint and from a healthcare business standpoint, the better. But you want to get as much training under your belt and under your staff belt as possible so that you can market yourself as a healthcare specific service business. Number 2 is create a targeted healthcare specific service portfolio. What I mean by that is what we said about your website. Take your list of services, Print them out, put them up on your laptop, however you want to do this. Create a targeted healthcare service portfolio by looking at each service that you currently provide and figuring out how that relates specifically to healthcare clients. And by accomplishing step one, and if you've already done that, good for you, take number two, take that list of services and identify for yourself how those services are specifically related to healthcare. As I mentioned before, number three, add a page to your central website which highlights your healthcare products and services. Make sure you have a spot to point people. If you're going to outreach to healthcare clients, don't point them to your general website. Don't point them to your general list of services. Point them to your healthcare page. Your healthcare page is what's going to let them understand that you are a better choice than anybody that doesn't have a healthcare page. And I will promise you that if you do that, your chances of nailing that client, of acquiring that client, have increased exponentially. Number four, if you do not yet have healthcare clients, offer to do the first few clients at a significant discount, and then establish your service skill, get some reliable industry referrals, add those referrals to your website, and create a reference list for yourself. If you have already been working in healthcare and you have not done this step, double back and do it. Call your former clients that you've had good experiences with and ask them for this level of recommendation or referral. I recommend, just from my own personal experience, touching the lowest level employee within that organization that will likely speak highly on your behalf, and that it will not be a big burden for them to take a phone call if needed. So if that's the front desk person and they had a great experience with you, touch that person. If that is the practice manager and you feel like that person might be willing to share their experience, whether that's a passive written referral or an active phone call that they would take from a future client, potential client, this is where you want to go. I don't recommend, unless you've been working with an independent medical practice and you've got a really strong relationship with the physician in charge or the owner physician, I don't recommend necessarily pointing yourself at the physician for these kinds of referrals. They don't have a lot of free time to take phone calls, but if they do, and if you've got a great relationship, great, that's even better. Because as I mentioned, doctors trust doctors, and so the more you can do that, the better. And then if that practice, now many of these practices also refer to other practices. They will make referrals to another specialist, for instance. They will do consults with other practices, with their patients, etc. Look for ways that you might potentially leverage that good relationship and get a referral to someone that they know. Doctors trust doctors, so leverage that, what you've built. The other thing I'm going to recommend, number five, this possibly should be number two, but number five is to identify on your staff an in-house healthcare champion. If you've got a large staff, or even 5 or 6 or 7 people, pick someone that will focus specifically in your group on the healthcare vertical, because industry relevant technology information is constantly shifting and changing, right? So the stat I quoted to you earlier of 32 million patient records breached, a year ago that was only 15 million patient records breached. You want to stay up to date with that information so that when you're outreaching to those medical communities, you have the right, most current data. But also, anything that changes in the industry around ransomware prevention, around the HIPAA regulations, around the cybersecurity relevant specifically to the ransomware that is attacking those healthcare patient records, that's the stuff that your in-house healthcare champion should know and stay on top of. Because if all of you are trying to stay on top of it at all times and also do your jobs, one thing I do know about managed service providers and those businesses is that they are working constantly. They are busy constantly. Their clients are super demanding, and that it is a tough job. So for all of you to try to be the healthcare champions, super difficult. But if you pick one person and that's their job to stay on top of that, and if you can pay for their continued training, they can keep everybody else up to speed. And I feel like that's a very important aspect of growing your healthcare business. The other thing you want to do is to have forms in place, ready for client use. Do not try to do this on the fly. Don't jump into this business and go, oh, shoot, that's right, I needed a BA agreement for this person. Where's that BA agreement again? Have those templates ready to go. If you're going to approach this market, be ready. Have BA agreements, risk assessments, disaster recovery documents specific to healthcare. Have this stuff ready to go. And I say that because what this is going to do is this is going to increase and improve your credibility with that client. If you talk that client side into working with you, or you're just putting together a proposal, if you submit a BA agreement with your proposal, they are going to know that you've done this before. This is a great credibility factor. Attend healthcare networking events. We talked about that. That's number 7. And consider hosting events to attract clients. Just repeating, your 8-point plan is reflecting some of the stuff we've talked about. And number 8, provide resources of value to healthcare clients, such as the HIPAA risk assessment service potentially, awareness training that they are going to need on an annual basis, cybersecurity recommendations around products and services that you might want to install. Know what are the best security protection softwares and services that you can recommend. Have those policies and procedures templates in place, etc. Those are the kinds of resources that you're going to want to have available in general for those healthcare clients, maybe even downloadable and accessible from your website. Adds a genuine aspect of credibility to your business. So I had mentioned before that it's super important for your healthcare champion and for you, if you're in a single practice, to keep yourself up to date on what is happening in health IT. What is going on? And what do you need to know as it relates to government regulations and resources? These are 3 high-level recommendations I'm going to give to you. And you're going to get this deck afterwards, so don't worry about taking notes on this. Expo Health is run by some people that I'm very familiar with in the industry. These guys stay on top of it. They know what they're talking about. So if you want to stay on top of it and you want to stay checked in, potentially attend networking events that are going to have a lot of good information around healthcare as it relates, you're going to want to talk to the Expo Health people or view their websites. Healthit.gov, obviously very, very important to understand more about what's happening in the health IT space. This is a free resource, lots of good documentation and resources available on that site. And then HHS is going to keep you up to date on what's happening in HIPAA, specifically for professionals and technology professionals. So you want to make sure that you stay on top of that. And for Med, one of the things that we do is that we will help by providing access to awareness training for your potential clients and allow you to add credibility to your platform, to your web services, to your online support services by providing security awareness training. You can do this at no upfront cost to you and be able to earn net referral revenue as well for being able to provide this kind of training. As I mentioned, credibility is a big part of this business. So you want to make sure that you are adding credibility to your bottom line. And one way to do that is to not only train your staff, but also to be able to provide that required annual awareness training. I was speaking the other day to a technology service company, and they essentially were speaking, and they are HITRUST certified, and they were speaking to me about the fact that when they do a risk assessment on a medical site, many times the missing piece for that practice when they run that risk assessment is that their in-house staff has not been properly trained in cybersecurity awareness, in HIPAA awareness, etc. That is where you can not only add revenue to your bottom line in your service contract, but you can also show the client that you are a credible healthcare resource. Everything that we offer in our program, there are other programs like this as well. Everything we offer in our program is nationally accredited for all clinical providers, nurses, physicians, physician assistants, etc. This program doesn't cost you anything. It can potentially add revenue to your bottom line, and it is a way to add value and credibility to that end user client. So we are at the 55-minute mark. We're just about ready to wrap up. If you have any questions for us that you have not thought of during the session, feel free to shoot us some questions after the fact via email. You're going to receive a couple emails from us. That is an email that you can reply to ask questions. You can also reach out to our Director of Relationship Management in case you're interested in that partner program that I mentioned. His name is Mark Byrne, and his contact information will be in this recording as well as on the screen right now, as well as in some of your follow-up messaging. But I hope that this session today has been helpful to you in terms of understanding a little bit more about how to outreach to the healthcare community and expand your business in the healthcare vertical. It is a worthwhile endeavor, trust me. Like I said, I did IT consulting and IT support for many years, and honestly, this is a vertical that can be extremely lucrative. It does build upon itself over time. The more healthcare clients you have, the more you will have. It's a very rewarding vertical. You're helping ultimately provide an improvement and a protection for patient information and patient care. And overall, you're going to appreciate growth in this area from a financial perspective. There is a lot of need, and the need is, as I mentioned with the patient record breach situation, the need is growing year over year. Technology is expanding over and over, and in much greater ways over the course of time in the healthcare vertical. This is a great vertical for technology and managed services. If you have any questions for me, you can reach out to me after the session as well. Like I said, these emails will come to you with a variety of contact information. Feel free to touch base with us. And hopefully you enjoyed this session, and we will send you some announcements for future free learning lunches around topics in healthcare and health IT. Thanks so much for joining us. It'll take about an hour for those follow-up emails to come to you and those recordings. But if you have any other questions at that time, feel free to reach out. Thanks so much for joining us, and we will hopefully hear from you soon.